Mr. Speaker, this honorable laws necessary for effective performance of functions assigned to the county government in the fourth stage of the Constitution, as well as vetting and approving of nominees to various offices in government. We shall endeavor to work together to forge a working county premised on discipline and prudent utilization of public resources. Mr. Speaker, Section 30K of the County Government Act 2012 requires the governor to annually deliver a state of county address before the county assembly. Address today, I will report on implementation status of county budget policies and plans across key sectors of our economy. In my manifesto, I committed to place people at the center of inclusive development with a focus on 5 pillars, namely devolution and governance, wealth creation, sustainable environment conservation, social development, and ICT as an enabler. In preparing the County Integrated Development Plan, CIDP, and the Annual Development Plan, ADP, we have identified strategic priorities expenditure programs in line with the transformative development agenda envisioned in my manifesto. My address will highlight where we are in implementing these plans as well as future plans. Mr. Speaker, let me start with health service delivery. Our goal is to improve existing health facilities and invest in universal health coverage to guarantee access to quality healthcare service for our people, especially the vulnerable ones. I wish to report that we have increased budgetary allocation to this sector, and this financial year we have set aside 4.14 billion Kenya shillings, up from 4 billion the previous year. Over the past year, we have implemented reforms in this sector and adopted a cashless payment system at the Kisii Teaching and Referral Hospital, as well as all level 4 hospitals. After sealing the reports through automation at KTRH, we collected 98.9 million Kenya shillings in the first quarter, 80.6 million Kenya shillings in the second quarter, 147 million in the third quarter, and 100.1 million in the fourth quarter. This figure could potentially go higher once we complete the ongoing digitization of service in our health facilities, Mr. Speaker. Mr. Speaker, recognizing the important role that human resource play in the health sector, we have released 10 officers, including doctors, clinical officers, and nurses for specialized training in emergency obstetric and neonatal care to improve mother and child health care.